Well, we're going to find out now from the Health Secretary himself about this. Steve Barclay, a very good morning to you. Thanks for speaking to us this morning. And this drug is making headline news for you today. We hope it is a game changer. We hope it helps the NHS and it helps the individuals involved. What are your hopes for it?
Well, it's hugely exciting. It's about us embracing the latest innovation. We know that obesity really causes health harm. 9 in 10 type 2 diabetics are overweight. It's the second biggest cause of cancer after smoking is obesity. And we also know that many people struggle. They struggle to lose the weight. They struggle to keep the weight off. So it's about looking at how we innovate. And it's not just in terms of this. We've got a pilot in Wolverhampton looking at incentivizing healthy behaviours. It's looking at having these injections alongside thinking about diet and lifestyle as well. But it's saying, how do we take the latest innovations in healthcare, ensure we use that to target the big health risks? And we know that obesity is a real health challenge, and it's a very exciting development to have this pilot to look at working innovatively, because if we can get obesity reduced, that will have huge impact to the NHS as a whole.
Right, so this is a 40 million two-year trial, and Wegovy is designed to suppress the appetite and reduce weight loss by up to perhaps at least 10%. The question is, do we have any in the UK yet? I know there were problems with building up supply. When will this come into force?
No, so it's part of our discussions that we'll bring this in later this year, but it's part of the signal to the suppliers that this is something the NHS is going to lead on. The funding is in place. We've been having those discussions with manufacturers. It is at the cutting edge, and we want to make sure that the NHS is at the front of the pack. And it's a very exciting development, but it's one alongside a range of other measures that we're taking. And we're looking at, for example, the pilot in Wolverhampton. We've brought in other measures in terms of calorie disclosure to better inform patients on menus. So there's a range of things we're doing, but this is a really exciting new technology, new drugs that are available, and we want to make sure they're available to people within the NHS at the earliest opportunity.
And can I ask, is this just about trying to help the NHS and the pressure on it, or is this also about trying to get people back to work?
Well, it has a big impact in terms of the workplace. We know that staff absence is a big challenge, comes at a big cost. We know that obesity has an interaction in terms of mental health and people's well-being. So there's a range of health benefits. I've touched on cancer, diabetes, mental health, MSK. So obesity really is a big impact on the NHS. We think it costs around £6.5 billion to the NHS, but it has, as you say, an impact on the labour market as well, and we're in discussions with the OBR as to how we measure the potential of reducing obesity in terms of getting people back into the workplace as well. But it's about empowering patients, and we know, as I say, that it has a big impact on people's health if they're overweight, but people struggle to lose that weight and to keep that off, and this is a really exciting development, and we want to make sure the NHS is at the front of the queue in rolling it out.
Secretary of State, today we will hear from the Prime Minister in Washington. You were talking about impacts on the workplace there. That's what he's trying to have an effect on as well with the American president.
Very much so, and obviously the US is our key strategic partner. We've got a range of important discussions that the PM will be having, but that also goes to the key challenges we've seen in the news in recent days, for example with Ukraine and our key alliance there, our defence partnership on things like AUKUS. So there's a range of issues which are a part of getting investment into the UK. He'll be talking about a significant programme of investment into UK business. That's great for jobs here. It's also part of our close ties to the US, and that's what the discussions today will be focused on.
And how serious do you think the Prime Minister is about what we think could potentially be a real legacy thing for him if he's able to get the ball rolling on some sort of global watchdog on AI? I mean, we were talking about his own advisor yesterday saying we've got 2 years to get a grip on this before it can start replicating itself and effectively affecting humanity. Serious stuff.
Yeah, it is, and I think there's huge excitement and opportunity with AI. I look at that within healthcare. We've been funding a whole series, 130 million of pilots through the AI labs. Things like strokes, for example, we can use AI to treat stroke patients much more quickly. We're seeing quite dramatic benefits to patients through using AI in strokes. I was up at Blackpool Victoria Hospital where they're using AI to pick up cancers that wouldn't be visible to the human eye. Extra 20% detection rate on those that were too small for people to see, but the AI was able to detect. And if you can detect it early, obviously the patient outcomes are far better. But alongside, there are risks as well to AI. So it's important we don't let those risks crowd out the opportunities. We need to look at this internationally, to work with partners, including the US, to get the right regulatory framework in place. But there's huge opportunities as AI, and in healthcare it's particularly exciting.
And just finally, Sue Gray has been cleared to join the Labour Party in the autumn. What do you guys think about that?
Well, I think there's some sort of leaks and commentary around that. Obviously, ministers don't comment on leaks, so I'll wait to see what is officially announced, and we'll take it from there.
OK, Health Secretary, thanks for your time this morning. Really appreciate it. Thank you very much indeed.